People with fatty liver or high triglycerides need to be very, very careful about starting a ketogenic or a carnivore diet. If you're not careful, what you'll find is that your high triglycerides return to normal in just a few weeks and your fatty liver goes away in just a few months. Be warned. Vanessa has fatty liver, Dr. Bikman. What would you recommend that she do?
Yeah, well, I'll answer my part, but as the clinician, Ken, I'd love to see and genuinely hear what you think about it.
Yep.
So just to cite human evidence, we know that most of the fat that comes into, so the liver gets fat through two processes. One, it makes its own fat when insulin is elevated. But that's the second part. So I'm starting with the smaller portion of it. Most of the fat that comes into the liver is actually fat that's dripping out of fat cells when the fat cells become hypertrophic and insulin resistant. That is not the same as lipolysis when insulin is low, because if you're breaking down fat when insulin is low, the liver can't store it, because remember, cells will only store fat when insulin is elevated. And so when you flip this around and now it's a hypertrophic insulin resistant fat cell, you not only have elevated insulin, but the fat cells become resistant to insulin's efforts to try to inhibit fat breakdown. And so the fat cell basically says, insulin, I'm too big. I can't grow anymore. I can't listen to you. So I'm going to start leaking fats anyway. Now you have this paradoxical and pathogenic metabolic state where you have both high insulin and high free fatty acids. The liver bears the burden now. And so most of the fat that's constituting the fatty liver is coming from the fat cells that have become insulin resistant. So the solution is resolve the insulin resistance. The best way to do that is to adopt dietary changes that allow your insulin to come down, because hyperinsulinemia is the primary driver of insulin resistance. So it's no surprise that there are some pilot studies, some deeper studies that show you can have complete resolution of fatty liver disease by just adopting a low-carb diet. Paradoxically, that might be higher in fat, because eating fat doesn't cause fatty liver disease. Insulin resistance does. And the relevance of the statins is utterly beyond me.